Hello friends, welcome back to Complete Medical Coding. Today this is a special episode because this marks the 100th video, the 100th chapter of mine. Okay, so today I'm here with some important mock questions. Anyway, let's move directly to the video. Okay, friends, if you like the channel, if you are liking my videos, please subscribe. Please subscribe and watch. Please press the bell icon also so that you will be getting the notification. Okay, I'm moving directly to the first question. First question. You can keep your CPT and ICD code books with you. Okay. First question. A 27-year-old male has morbid obesity with a BMI of 45 due to high calorie diet. He has decided to have an open Roux-en-Y gastric bypass. The patient is brought to the OT, operation room, and placed in supine position. A midline abdominal incision is made. The stomach is mobilized and proximal stomach is divided and stapled, creating a small proximal pouch in continuity with the esophagus. A short limb of the proximal bowel of 155 cm is divided. It is brought up and anastomosed to the gastric pouch. The other end of the divided bowel is connected back into the distal small bowel to the short limbs gastric anastomosis to restore intestinal continuity. The abdominal incision is closed. What codes are reported for this encounter? So here the patient is having BMI of 45. So those who are having BMI of 45 or more, you have to code it. Okay, you have to mark it in your coding. If the BMI is below 45, you don't have to code that. Okay. So now this patient is having gastric bypass. And how the procedure is being carried out, that is what is mentioned. Anyway, let's find out the CPT code first. Okay. First option 43847. Please go and take 43847. What is 43847? Gastric restrictive procedure with gastric bypass for morbid obesity with small intestine reconstruction to limit absorption. Yes, this is small intestine reconstruction, right? Reconstruction of small intestine is also done. It is mentioned almost at the end. See, the other end of divided bowel is connected back to distal small bowel to short limbs gastric anastomosis to restore intestinal continuity. So that is reconstruction, intestinal reconstruction. Okay, so 43847 is the correct code. Still, we can check the other CPT codes as well. First, we can find out the CPT code. Then we'll go to the ICD code. Okay, because here CPT code is only one in all the options, so you can easily find it out. Now, what is 43644 in option B, and in option 3, 43645. So, what is 43644 and 43645? Let's find out that first. 43644. 43644 is laparoscopy surgical gastric restrictive procedure. Roux-en-Y gastroenterostomy. Now, this is not laparoscopy. It's not mentioned anywhere about laparoscopy. And 43645 is also again laparoscopy with gastric bypass and small intestine reconstruction. This is not laparoscopy. Okay. So, the correct CPT code here is 43847. 43847 is the correct CPT code, which is there in two options, option A and option D. So, you can skip options B and C. Now, moving to options A and D. From that, you can find out the correct ICD code. If you check the ICD codes, one ICD code is same in both the options. Z68.42, that is same. Okay. And what is the next ICD code? E66.01, that we have to find out. The E code, whether it is E66.01 or E66.9 in option D. So, find out that first. E66.01. What is E66.01? Open your ICT code book and take E66.01. E66.01 is morbid. Morbid, that means severe. Severe obesity due to excess calories. Obesity, that is understood that BMI is high. Of course, obesity means high BMI, right? So, severe obesity due to excess calories. Yes. We need, this is morbid obesity. It's mentioned in the question, morbid obesity. You can still check what is E66.9. E66.9 is, what is E66.9? Just obesity mentioned. So here it is, as it is clearly mentioned that it is morbid obesity. You need to code that E6601. So here you got the correct answer as option A. Still go and check what is Z68.42. You have to always check Z68.42. What is Z68.42? BMI of 45. Body mass index of 45 to 49.9 adult. So, as I told you earlier, this is a guideline while coding, okay? For those who has a BMI of 45 and above, you have to code this Z code. But for those which is lesser than 45 BMI, don't code. Never ever code BMI which is less than 45 unless if there is any special conditions or something like that. But still, don't code this Z code less than 45 BMI. From 45, you have to code it. So, mark Z68.42. So, here we got the correct answer as option A. 43847, E66.01 and C68.42. Okay, option A is the correct answer. Now, second question. A 30-year-old female is having debridement performed on an infected ulcer with a scare on the right foot. Using sharp dissection, the ulcer and scare infection was debrided all the way down to the bone of the foot. The bone had to be minimally trimmed because of a sharp point at the end of the metatarsal. After debriding the area, there was minimal bleeding because of very poor circulation of the foot. It seems that a toes next to the ulcer may have some involvement and cultures were taken. The area was dressed with sterile saline and dressings and then wrapped. What CPT code should be reported? So here they are asking only the CPT code. The whole procedure, how the whole procedure is being carried out is being mentioned here. And the debridement is a procedure that is going to find out here. That we have to code. Okay. Anyway, moving directly to the options. First one, 11100. Go and take 11100. That is debridement of extensive extremities or infected skin up to 10% of body surface. 11100 is debridement only up to 10% of body surface. What is 11011? 11011. Debridement including removal of foreign material at the site of an open fracture or open dislocation, skin, subcutaneous tissue, muscle fascia and muscle. 11011. Okay, this is the description for 11011. Now next one, 11044. Option C, 11044. Debridement of bone includes epidermis, dermis, subcutaneous tissue, muscle and or fascia if performed. First 20 square centimeter or less. Here what is debrided? See the second sentence in the question. Using sharp dissection, the ulcer and scare infection was debrided all the way down to the bone of the foot. Until the bone it is debrided. So this is debridement of bone, right? So hopefully we got the correct code as 11044. Still you can go and check the option D, 15004. 15004. What is 15004? Surgical preparation or creation of recipient site by excision of open wounds, burn, scare or incisional release of scare. No, this is excision of open wound. 15004 is excision. No, that is wrong. This is debridement. Okay, so we got the correct answer as option C, as mentioned earlier, 11044. Okay, debridement of the bone. Alright, now moving to the third question. Third question, an 8-day-old newborn weighing 3 kilograms is seen for circumcision. The infant is placed on a restraining board and a dorsal penile block is given as the anesthetic. A dorsal slit is made at the top of the penis. The Gomco circumcision clamp is applied and the foreskin was excised with a scalpel. What CPT code is reported? So this is something which is related to male genital system, right? So it will be under 50,000 series. Male genital system. Yes, circumcision. So here you have to code for the circumcision. We can go directly to the options, to the codes. Okay. Option A, 54150. What is 54150? See here, if you can see, only two codes are there, 54150 and 54160. Let's find out which is the correct code. 54150. Circumcision using clamp or other device with regional dorsal penile or ring block. Circumcision using clamp or other device with regional dorsal penile or ring block. And down in bracket it is mentioned, do not report modifier 63 in conjunction with 54150. You should not report 54150 with modifier 63 is mentioned. Then report 5 again down, report 54150 with modifier 52 when performed without dorsal penile or ring block. Here the circumcision is performed with the dorsal penile, right? The infant is placed on a restraining board and a dorsal penile block is given. So the first option is wrong. 52 modifier is used if the circumcision is being carried out without the dorsal penile block. But here it is carried out with the dorsal penile. So option A is wrong. And 63 modifier also you can't append it with the modifier with the CPT code 54150. Okay. What is 63 modifier? What is 63 modifier? Usually 63 modifier is being coded for a procedure for neonates procedure, for infants. Okay, weighing up to 4 kg. Append modifier 63 to a code for a procedure that a provider performs on a neonate or infant weighing up to 4 kg. Okay. Anyway, here you can't use the modifier along with the CPT code 54150 as mentioned in the CPT code book. So first option is wrong. And option B, 54150 only. What is option C? 54160. 54160, circumcision. What is 54160? Circumcision, surgical excision other than clamp, device or dorsal slit. Neonate, 28 days of age or less. Surgical excision other than clamp or device. Here this is done using the clamp, right? See, the Gomco circumcision clamp is applied. So this is using a clamp. So the correct code will be 54150. Okay, 54160 is wrong code because that is using a clamp. Sorry, without using clamp. So here the correct answer is option B, 54150. Answer is option B, 54150. Okay, hope you understood. Now moving to the fourth question. A patient presents with a broken pin in the right ankle. The patient is taken to the surgical suite and placed in the supine position. After local anesthesia, the patient's right ankle is prepped and draped. A 1 centimeter incision is made and dissection is carried just under the skin, removing the broken pin. The wounds are thoroughly irrigated with antibiotic containing saline. Skin is closed with adhesive strips. What codes are reported? Okay. So here you have to find out the CPT and ICD code. broken pin. Patient presents with a broken pin in the right angle. Okay, so broken pin in right angle. You have to find out. They are removing the broken pin from the right angle. Anyway, let's move. Let's find out the answer. First code. Let's find out with the CPT. Let's begin with the CPT first. Go and take option A, 20670. 20670. Only two codes are there. Two CPT codes are there. 20670 and 20680. Let's find out which is the correct one. 20670. Yeah. 20670 is removal of implant, superficial. Example, buried wire, pin or rod. So broken pin in the right angle is being taken out. So something was inserted before in the right angle, like a what do you call it? Yeah, implant. You can say an implant. So that is broken, that they are removing as incision. After an incision is being made, they are removing that broken pin. So 20670 is removal of the implant, and in bracket it's mentioned superficial, buried wire, pin or rod. What is 20680? Same, removal of implant, deep. Example, buried wire, pin, screw, metal band, nail, rod or plate. So 20670 or 20680. If it is superficial, you have to use 20670. If it is deep, you have to use 20680. How you will find out if it is a superficial or deep? See, in the question, third sentence, fourth sentence, a 1 centimeter incision is made and dissection is carried under the skin, removing the broken pin. So it's only a 1 centimeter incision which is made for the removal of broken pin. So 1 centimeter means, of course, it is superficial, it is not deep. Okay, so the correct CPT code will be 20670 here. Okay, 20670, which is in options A and D. So you can skip out options B and C. So the answer will be either option A or D. Now you have to go and find out the correct ICD code. Okay, now let's find out the correct ICD code. What is the first one? T84.418A. T84.418A. The first ICD code, the ICD code in first option. Go and take T84.418A. What is T84.418A? Breakdown mechanical of other internal orthopedic devices, implants and grafts, initial encounter. Yeah, breakdown of some orthopedic device, initial encounter. That is T84.418A. Of course, this is an initial encounter. Now, if you, now in option D, we already skipped options B and C. Go to option D. What is the code, ICD code? T84.69XA. T84.69XA. What is T84.69XA? Infection and inflammatory reaction due to internal fixation device of other site, initial encounter. If there is any infection or inflammatory reaction, okay, because of the internal fixation, you have to code this one. No, this is not the infection or inflammatory reaction, but what is this? This is a breakdown of an internal orthopedic device. Yeah, that pin has broken, right? Broken pin. So this is a breakdown of the orthopedic device. So the correct ICD code here is T84.418A. Okay. So you got the correct answer as option A, 20670 and T84.418A. Alright. Hope you understood. Now moving to the fifth question. The neurologist spends 15 minutes one-on-one preparing the patient and placing needles for acupuncture with electrical stimulation. She leaves the needles in place for 20 minutes. She returns, removes the needles and repeats the procedure, again spending 15 minutes one-on-one placing the needles, leaving the needles in place for 20 minutes and then removing the needles. What CPT codes are reported according to acupuncture CPT guidelines? Yeah. So here the neurologist spends 15 minutes on a patient placing the needles initially, okay, for acupuncture with electrical stimulation. So initially needle is placed for 15 minutes, then she leaves the needles for 20 minutes. Again, she repeats the same procedure, 15 minutes spending on placing the needles and then leaving it for 20 minutes. So that's how the procedure is carried out. So this acupuncture you have to code. How to code acupuncture here. Alright. So let's find out the answer. Let's go to the codes directly. What is the first one? First code 97810. One take 97810. 97810 is acupuncture one or more needles without electrical stimulation. Initial 15 minutes of personal one-to-one contact with the patient. This is with electrical stimulation. It's mentioned in the first sentence. Placing needles for acupuncture with electrical stimulation. So 97810 is the wrong code because the code description is without electrical stimulation. Okay. So skip that. So you can directly skip options A and D. Because in option D is also same code 97810. So skip that options. Now let's move to options B and C. What's 97813? 97813. Same acupuncture, one or more needles with electrical stimulation. Yes, we want this code with electrical stimulation. Initial 15 minutes of personal one-to-one contact with the patient. Yes, it is 15 minutes for placing the needles. So initial 15 minutes, 97813 we need. Okay, times 2. In option B it is mentioned times 2. And in option C, what is the second code? 97814. 97814 is acupuncture one or more needles with electrical stimulation, each additional 15 minutes. Yes, here the neurologist did acupuncture. She repeated it again, right? She repeated it again for another 15 minutes for placing the needles and then 20 minutes for leaving the needles. So initially first 15 minutes you have to code 97813 and then the next 15 minutes you have to code 97814. Since there is a two different codes, you have to use this code. You should not use 97813 times 2 because there is a separate code for additional 15 minutes. So go for option C. So here the correct answer is option C. Okay, 97813 and 97814. All right. So friends, these are some important mock questions. I'll be coming back again with more and more mock questions. So please stay tuned. You should go. You should watch my practice questions as well because you will definitely get questions from the practice questions as well. Okay, not only from the mock questions, from the practice questions also. So make sure to watch the practice questions because sometimes I'll be explaining some guidelines also from the practice questions. So please don't skip those videos also. Okay, because I'm seeing practice questions many are skipping and they are directly taking my mock questions only, videos only. So please, you will definitely get questions from the practice questions as well. So please don't skip. Okay. Hope you like my video. And please subscribe, friends. If you are new to the channel, please subscribe. And please share this video among my friends, among your friends. Okay. So thank you so much and stay tuned. Bye. Take care.